Hello everyone. Today we're going to talk about coronavirus, COVID-19. Certainly, you or one of your relatives or friends suffered from fever, cough, or general weakness, and you were diagnosed with coronavirus. As we can see, all countries of the world are currently suffering from the outbreak of the corona pandemic, which has infected and killed millions and disrupted all aspects of life. Despite the progress in the health field, doctors have so far been powerless to contain this dangerous pandemic. Coronaviruses is a large family of well-known viruses, such as MERS and SARS. A new coronavirus is identified in 2019 in Wuhan, China. This virus is a new strain that has not been previously identified in humans. You must have some questions about this virus, but don't worry. During this video, we'll explain to you everything related to this pandemic. Our role today is to answer most of your questions regarding coronavirus, COVID-19. Today, we have Doctor Sohn, who is a leading doctor at Korea University Anam Hospital. He's going to discuss with us everything about coronavirus from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Sohn, how are you?
Hello.
So can you introduce yourself to us?
Hello, my name is Jungwook Sun, and I am the head of Infectious Disease Department at Anam Hospital in Korea University.
Nice to meet you. So today we are going to talk about the very popular topic, coronavirus. So what is exactly coronavirus?
Coronavirus refers to viruses within various types of coronavirus. It looks like a crown, so it's called the coronavirus. Now, there is COVID-19 as a type of coronavirus, and SARS and MERS, which were popular in 2003, are also a type of coronavirus. In addition, the virus, which was prevalent, like a cold, is a type of coronavirus, a virus that infects people, and is mainly known to be infected by mammals and birds.
So how does the coronavirus get infected?
COVID-19 is transmitted mainly through coughs and droplets. There's also the possibility of propagation by physical contact.
So what are the main symptoms of this virus? And how is it different to another flus or colds?
The main symptom of COVID-19 is known as fever. Additionally, there are symptoms such as coughing and helplessness can be accompanied. In fact, it is very difficult to distinguish cold from symptoms.
So how do we diagnose coronavirus actually?
The most accurate method we are using now in Korea is the PCR method of amplifying and diagnosing genes, and samples are tested through nasopharynx and oropharynx. The most accurate method is the PCR inspection method.
So what is the asymptomatic type of coronavirus?
Just because you have a virus doesn't always show symptoms. Some patients may show no symptoms at all, and in that case, they can release the virus they own to others. Because you don't have symptoms, you don't pay attention to yourself, which can cause the virus to spread. A condition without symptoms is called asymptomatic. The most important problem in this case is that it is fatal to public health.
So what is actually Delta coronavirus? And what are the mutation of it?
The virus infects the human body, spreads, and mutates. The mutated virus occurred based on various regions such as England, Brazil, and India. And the media reported the mutated virus along with the local name. However, the name of the virus is required to be marked with alpha, delta, beta, gamma, etc., because it can raise an issue. In fact, the Delta virus in India is a mutation. The strengthening of the part of the virus that attacks the human body has greatly increased the propagation power, and much higher than the existing virus in Wuhan. And now it has become a mainstream virus that causes human infection. If the virus continues to spread in the human society, it will continue to mutate. then the effects of conventional vaccines or treatments are getting weaker and the virus is getting stronger. It is important to break this vicious cycle.
So what are the prevention of coronavirus? Is it necessary to take the vaccination as well?
Vaccines are the most important way. The second important way is to do what we can. You should thoroughly wash your hands, wear a mask, and refrain from outdoor activities, and go to the hospital if you feel you have cold symptoms. Even if the test is determined not to be a coronavirus, don't go outside and follow the personal quarantine rules.
So that's it for today. Thank you so much for your time, Dr. Sohn.
Thank you.
감사합니다. Today we learned many things about coronavirus, and the doctor explained in details everything related to this pandemic, such as its symptoms and diagnosis, and available treatments, as well as role of different vaccines. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below, and we will respond to you as soon as possible.